For Bill Howe, cancer led him down a deep hole that went far beyond the physical effects of treatment. Increasingly, healthcare providers are realizing that there are many mental health issues involved in cancer diagnosis.
There are many issues and problems that patients and their families face when they have a diagnosis of cancer. And they are not all in the physical realm. The issues and problems can range from transportation issues, worrying about child care, worrying about taking care of elder parents, to the emotional aspects of having an uncertain future and uncertain treatments and what the prognosis might mean for both the patient and the family.
In September 2001, I was diagnosed with prostate cancer. The results led to surgery on that September 28th because the time, of course, was an issue. The physician who did the surgery indicated that he felt he had gotten it all. And it was the first part of October when I received a telephone call indicating that he termed it a positive margin, which basically meant that the cancer had got outside the prostate and was also in the perineural system, which is a good transporter of cancer cells. After the surgery, it was chemotherapy for a few months, and then after it was chemotherapy, then we went into hormone therapy. Had a severe reaction to that, and we had to drop the hormone therapy. Then we went into radiation therapy, and we completed that. And somewhere along during that time, they also reinstituted the hormone therapy. The combination of the treatments and the emotional roller coaster that you ride when this happens to you, you get into a situation where you're very confused, you're lost, your anger is prevalent. You want answers and you can't get them.
There are many mental health issues regarding cancer. In the very beginning, often patients have adjustment issues, just related to hearing the diagnosis and trying to figure out what that means. But like anybody else, people have histories, so often patients have a history of some mental health problem, either substance abuse, anxiety, depression, or other issues. And so when they come into cancer, it's not like a clean slate. The cancer is added on to past problems. I
was talking with the oncology folks at the University of Michigan that were treating me, and they were very supportive, and they directed me to Dr. Reba.
At the University of Michigan Comprehensive Cancer Center, we have a psycho-oncology clinic that's located physically within the cancer center. We have found that this is a really good idea for patients to be able to get their care. Some patients who want to get their care at the time of their clinic appointment, who need some acute interventions and can get an appointment almost immediately through our clinic, which is located physically right at the building. We're able to provide for a full range of individual care, medication management, couples, and family work as well.
I think I could best equate it to like drawing a map of an underground cave without a light. If you were to attempt to do that, that's where we started. And if you're down there and you're trying to draw a map of an underground cave and you can't see where you're going, you don't know if you're going to fall into a cavern, you don't know if you're going to hit your head, you don't know if you're ever going to get out. That's where you start.
What has really been very helpful in our field is the development of guidelines for both patients and for clinicians to evaluate distress, DISTRESS, at evaluations and follow-up visits for patients and their families. And what these distress guidelines are ways for us to think about for patients to use a very simple, what we call a distress thermometer. It's from 0 to 10, and patients check off where they are at during that interview in terms of their distress. And then they are asked to tell us with a check off, and then they can fill in more if they want about what the distress might be.
I'm doing better. I think that it has been a long road, and it will continue to be a long road.